What the name change says to me about the North Carolina Healthcare Association is that they are really being intentional about reinterpreting their vision in today's context.
I like that NCHA is making a real outward statement that the focus is on healthcare outcomes, that it's all about making healthcare better for North Carolinians. And I think the name change really states that in a way that is clear and strong, and obviously something that we support and a goal that we share.
We're so far behind the 8 ball in the world of how we take care of illness. We're reactionary to it. I think we need to be proactive. We need to work on obesity. We need to work on childhood pregnancy. All these issues that we end up spending so much money for on the end rather than preventing the issues ever to begin with. And it's great to have one umbrella organization to say, hey, let me bring all the stakeholders together and let us come to the table as equal partners and talk and see how best we can move this entire health program and help move it forward.
But I think that there has to be a convener, some organization that pulls everybody forward and puts us all in the same room, gives us the opportunity to talk about healthcare from our perspective. And I think the Healthcare Association will be able to serve as a convener because you have physicians, you have nursing, you have all of the ancillary pieces associated with it in the hospital. I think it's just important that we move outside of those 4 walls and actually engage the community and engage the patient and bring the patient into the whole healthcare component of what we're trying to do.
You can word it collaborative, you can word it getting along, you can work it strategically, prioritization of resources and using them more effectively, but ultimately the people that are providing the care, everybody that has a touch part of the process, that has some kind of role in providing patient health care, that they have to be talking to each other and have to be working closer together. And so the more leadership that's provided by various organizations to that end, ultimately will result in the patients receiving the care they need.
We recognize that the nurses are just one part of that equation, but we're also the largest segment of the healthcare workforce. So that's an exciting statement for us that NCHA is going to be drawing those providers closer and talking to us more about the challenges that we face and the challenges that we share so that we can hopefully do our best in response to all of those together.
So I think businesses, dominant businesses in their community, or if there's not, groups of them, have a responsibility to come to the table and be clear about what their expectations are and to build collaborative models from the ground up. It's one community at a time. It's not a statewide initiative, arguably not a regional initiative. It's one community at a time coming together to say, we've got to drive common definitions and we want a healthier population so that we can have a healthier economy, so that there's more jobs, so that the schools can have the resources that they need. It's all inextricably linked to that.
I do think that this idea that the North Carolina Healthcare Association is bigger than just hospitals, and we're helping our members and their communities kind of unite and convene to develop new strategies, new ways of caring for communities and caring for people, I think kind of hits that sweet spot and certainly resonates with our new tagline, because I think it's less about what we call ourselves and more about what we do.
We've gone beyond just taking care of people who are ill. We're actually increasingly focused on preventative services, on screening activities, and other interventions that actually measurably improve the health of the communities in which we serve.
So we need to be open-minded to create something that has never been created before, but also to make sure that the costs in delivering those services are very important as well.
If we keep the focus on that second part of the strapline, developing healthier communities, helping to lead the charge for healthier communities, that if indeed we can help our most challenged communities achieve a higher health status, then I believe that the members of the Healthcare Association will continue to thrive in that environment, and more importantly, North Carolina will thrive.
And the bottom line is, we're not here for ourselves, we are here for the patient. So let's put that at the forefront and let's all figure out how to be around the table in a circular table and make the patient the center of the table.
when we look at it, if we're all collaborative and we're all working together, we're all going to be happier. We're going to find joy in work. Patients are going to be more satisfied with their care, and we're going to see better population health and healthier communities overall.
So when I think about the future, it's about tying those things together. It's about transforming and continuing to change not only the association, but also to support our members as they change, and really be a catalyst for the next century. And I think that's what's really exciting.
We've had a rich legacy of our associations, and I see this as an opportunity now as we bridge together hospitals, health systems, and care providers to have a united front, and in that united front, make sure that the citizens who need wellness and health in our state are always at the center of the decisions that we make.